Evidence shows that research-active health and care settings have better patient outcomes. Research helps to create change in people's health, lives, their communities and workplaces, in services and policy, and everyone deserves the opportunity to get involved.
It's important to mention research to patients because they are our opportunity to contribute to science and an evidence base.
Nothing can change or nothing can get better without research.
If there is a little difference that can be made, it can only be done by the research, by pushing the science a bit further as we go along.
Research can also provide hope in cases where some people have tried all current treatments and medicines to no avail.
Personally, I had a 95-year-old man that I had seen 2 years ago who said I was the only one person who had actually visited him many times and that he was feeling special about it.
And so we know that when people access our mental health services, there's an important opportunity for our health and care staff to engage in conversations about research.
When my GP approached me about the research, I felt quite honoured that he thought I could do it because I was feeling my esteem was quite low at that point.
It's that idea that I could improve somebody else's experience where I have pain or a difficult memory. It's almost like I'm helping to rebuild and heal those kind of wounds.
When we talk about recovery in mental health and learning disability and dementia, we're not just thinking about someone who becomes less depressed. Recovery is also thinking about, are there positives that can be taken from this experience?
If every member of staff who has contact with the people accessing our services engages in this opportunity, together we can all make a difference in improving mental health treatments and services.
Talking about research helps us to engage with the patients more and for them to contribute to something that would either help themselves or many in the future.
My mental health is a lot better because I feel that I'm contributing and being part of something. It's one of the things that I'm quite proud of in my recovery.
As health and care workers, no matter your role, we all have a part to play in ensuring the people who need our help are told about what research studies might be available to them, whether that's an online survey or a drug study.
Some clinicians can be apprehensive about their patients being approached for research. In my experience, people are really receptive to research.
So I've spoken to lots of different staff who said that they're really worried about asking people about research. But I think we also need to hold in mind that people actually have the right to know that they could be part of research studies. There's a danger to us making that decision for them. If people are worried about risks or other reasons, then there are lots of people they can speak to. Their senior managers, the medics in the team, or the research and development team, who can give them advice and have a think about that together.
Often if clinicians come in feeling a bit underconfident or they don't know that much about research but they're interested and keen, that's fine. We have an expert team that can help and be on hand.
We hope this video will help staff to feel confident to be able to have conversations about research with the people needing our services in a way that doesn't make them feel under pressure in any way to sign up.
At any time I realised that I could choose not to take part.
There were one or two studies that I was offered that I just didn't feel were relevant to me, so they were able to come with another study they had going on, which was,
if a participant doesn't want to participate in that research, if it's appropriate, we'll ask some questions. Perhaps we can look at changing again in the future to make the research more successful or perhaps more supportive for the patient. As part of our clinical research network, every year we do a survey that captures what it's like to be a research participant, and that is wholly positive, and we can share those with our patients so they get that feedback and they're able to access that themselves so it's unbiased.
We need all health and care professionals to come on board. All the doctors, nurses, allied health professionals, practitioners, pharmacists, everyone, to make it a priority for our patients and service users. Research changes lives.
every time I got involved in a study, I was stunned by how it impacted me as well. It's helped me feel empowered and sort of highlighted my resilience.
Talk to your patient or service user about opportunities available to them at their next appointment. Together, we can all make a difference.